Arpita KHASNAVIS, you can present, ma'am. Yeah, Mahima, you do know that you're not a ratified member, so your paper will not be eligible for the competition. You can just present. You can come here. So Arpita KHASNAVIS.
Good afternoon, everyone. I'm Arpita KHASNAVIS, and the topic that I would be presenting is Colletotrichum keratitis, the clinical features, risk factors, and outcome. So the genus Colletotrichum, it's a demeticious fungus of the Coelomycetes group, and it's a plant pathogen known to cause anthracnosis. In humans, they cause subcutaneous and systemic infection as well as keratitis. The Colletotrichum species associated with human ophthalmic infection include Colletotrichum demeticium and Colletotrichum cocodes. Early identification, antibiotic susceptibility evaluation, and early initiation of appropriate treatment can help in faster resolution of signs and symptoms and avoid complications like perforation and endophthalmitis. It's a rare case of microbial keratitis, but there are very few case reports and small case series of Colletotrichum that have been reported worldwide. The data regarding clinico-microbiological profile and treatment outcome of Colletotrichum keratitis needs further evaluation. So it was a retrospective study carried out in a tertiary eye care center. Patients diagnosed with culture-proven Colletotrichum keratitis from January 2020 to December 2021 were included in the study, and data collected were demographic details, risk factors, the ulcer characteristics, the visual acuity at the time of presentation and final follow-up, the management, and the final outcome. At the end point of evaluation, we defined our result as complete success when there was complete resolution of the infiltrate with formation of a scar on medical management alone, partial success when there was complete resolution of infiltrate on medical treatment as well as minor surgical treatment like the use of cyanoacrylate glue and bandage contact lens, and the result was declared as failure when there was worsening of the ulcer necessitating therapeutic PK or evisceration. So 49 eyes of 49 patients were included in the study. 55% of the patients had superficial infiltrate at the time of presentation, and 45% patients had deep infiltrate. 67% patients were diagnosed with Colletotrichum cocodes, and 33% had Colletotrichum demeticium. At the time of presentation, the group with superficial infiltrate had significantly better visual acuity compared to the group with the denser infiltrate. There was no significant difference in the ocular risk factor or the type of trauma. However, there was significant difference in the duration of symptoms, with patients with dense infiltrate having a longer duration of symptom. Moving on to the ulcer characteristic. Patients with dense infiltrate had a central ulcer, which explained the lower visual acuity at the time of presentation. They had significant thinning, and perforation was noted in almost 14% of the patients at the time of presentation. Moving on to the management part. At the time of presentation, medical treatment was started for 75% of the patients in patchy superficial infiltrate, and 31% received medical management alone in the dense group. In the primary medical therapy, maximum patients were treated with natamycin or combination of natamycin and ketoconazole. Just 5% patient in the denser group received amphotericin with ketoconazole because of the worsening infiltrate. 75% of the patients in the superficial patchy infiltrate group improved on medical management alone, whereas just 18% of the patient with the dense infiltrate improved on medical management, and 83% of the patients required further surgical intervention. After minor surgical intervention, 93% of the patients in the superficial group improved. However, 77% of the patients in the deeper infiltrate group required surgical intervention in the form of therapeutic PK or a tectonic PK. At the final outcome, in the visual acuity, there was significant difference in the visual acuity in the superficial infiltrate group compared to the denser infiltrate group. There was a smaller subgroup of patients in whom susceptibility for various antifungals were carried out. And as we can see, the MIC concentration for ketoconazole and voriconazole was the lowest amongst all the antifungals. However, all our patients were treated with ketoconazole and natamycin. None of the patients were given voriconazole, and they all improved and responded to natamycin and ketoconazole alone. So, but because of a very small sample size, this cannot be extrapolated to a larger population, and a larger study would be required with a larger sample size. To quickly conclude, superficial infiltrate group, 93% had good anatomical outcome, with 75% patients having primary success, 18.5% with partial success, and failure noted in 7.4% of the patients. In the deeper infiltrate group, 13% patients had primary success, 4.5% had secondary success, and 81% had failure. So it's Colletotrichum keratitis, often linked to trauma, has better outcome with early treatment. The dense infiltrate and delayed presentation often necessitate more invasive procedures and result in poorer outcomes. Thank you.
Thank you.